Well, depending on the patient's individual results, depending on their hormone levels, depending on their age, depending on a lot of factors, we'll identify whether a patient can use her own genetic material, her own eggs, or if we're going to need a donor to provide the eggs in order to fertilize and then continue the procedures. So with the testing that we require or we ask for, we'll identify a lot of questions as far as if your eggs can be used for a healthy, natural, normal pregnancy. If the answer is yes, then perfect. We can stimulate you during an IVF. We'll stimulate your eggs, or your ovaries. We will retrieve your eggs, and we'll fertilize those eggs with the sperm sample. Now, the sperm sample can either be a donor or your partner, or whatever sperm sample we can use or you would like to use. Whenever we are determining if you can use your own genetic material, your own eggs, there are a couple of factors that we have to take into consideration. One, your hormone levels. Your anti-Mullerian hormone will give us an idea of the quality of your eggs if you still have some. Your age. The age determines the quality and the quantity of your eggs. If you are within a reasonable age, you can still use your own eggs. We still have to identify the quality during the stimulation, during the egg retrieval, during the procedure. Once it has been determined that you cannot use your own eggs, after the stimulation, after trying, after studying, after all these procedures have been completed, and it has been determined that we cannot use your own eggs, then we can move on to the second option, which is egg donation. So if this diagnosis has been given, what we do now is we give you the option of selecting an egg donor. We will show you profiles, we will show you characteristics, we'll give you the option of selecting an egg donor which best suits your requirements, best suits your needs or your likes. Once you select her, we will actually now use those eggs to fertilize with your partner's sperm sample, and then the embryos that are created from that process or from your own eggs can be transferred to begin the pregnancy. Sometimes we don't know the answer to that question until we are in the stimulation, until we are in the process of retrieving the eggs, until those eggs are in the laboratory. Whether it be your eggs or egg donation from a donor, we do not know the quality until they are fertilized or under the microscope with our laboratory, in the laboratory, and in the process of the ICSI fertilization.